The debate over hormone replacement therapy, HRT, savior or risky gamble. Welcome to a conversation that's hotter than the flashes we're trying to cure. Hormone replacement therapy, HRT. Is it the best thing to ever happen to midlife wellness, or are we rolling the dice on a risky gamble? Like most great debates, the answer depends on how you look at it. Let's break this down and figure out if HRT is the hero you've been waiting for or just another overhyped treatment with a complicated reputation. HRT, or hormone replacement therapy, is a medical treatment designed to supplement the natural hormones, primarily estrogen and progesterone, that your body starts producing less of during menopause. Think of it as an ally that steps in when these hormones clock out. Women turn to HRT to battle some of menopause's least charming symptoms, like hot flashes that turn beds into saunas or mood swings that could rival a daytime soap opera. Beyond just feeling better, HRT is also believed to strengthen bones and promote overall wellness in some cases. But before you click the subscribe button on HRT, there's more to the story. It's a treatment steeped in mysterious risks, sensational headlines, and a history of scientific debate that even the most patient researchers might find exhausting. Let's talk about menopause, because Hollywood sure hasn't. Menopause marks the end of a woman's reproductive years, and with that, the body's production of estrogen and progesterone dips like a poor stock market day. When this happens, it's not just your ovaries that throw a tantrum. Hot flashes, night sweats, brain fog, and fatigue are some of menopause's greatest hits, regularly disrupting women's lives. And let's not forget that these hormonal changes weaken bones, increasing the risk of fractures and osteoporosis. Now enter HRT, stage left, as a possible savior. But before rolling out the red carpet, let's uncover the science behind how it works. HRT works by reintroducing estrogen, and sometimes progesterone, to supplement what your body is losing. It's like hormone karaoke. You're adding back the verses that your body forgot. There are options galore: pills, patches, gels, creams, you name it. Some treatments even use bioidentical hormones, which are molecularly identical to those your body makes, while others use synthetic hormones. The variety ensures there's a prescription style for almost every lifestyle. Sounds dreamy, right? Relief, better bones, fewer tears during coffee commercials. Who wouldn't want on board? But like any good plot, there's a twist. Why is HRT such a polarizing topic? Blame it on old studies, misinterpreted data, and, yes, the media. Back in the early 2000s, a massive study, the Women's Health Initiative, WHI, suggested HRT carried risks of breast cancer, strokes, and blood clots. Cue panic. The headlines burned brighter than a menopausal heatwave. But hold on. Scientists have taken a second look. Turns out, the risks were presented without enough nuance or consideration for factors like age and health history. HRT, like your favorite pair of jeans, doesn't fit everyone the same way. What we know now is that individual risk matters big time. Let's unpack this further. Is HRT a risk? In some cases, yes, but risks are not one size fits all. Here's what modern research tells us. Breast cancer. Some studies suggest a slight increase in breast cancer risk for certain types of HRT, specifically those that combine estrogen and progesterone. However, timing is key. Starting HRT years after menopause may increase the risk more than starting closer to your last period. Blood clots and strokes. These risks largely depend on how HRT is taken. Pills carry more risk for clots than patches or gels, which bypass the liver. Heart disease. Here's the kicker. It's not about HRT alone. A woman's overall health and timing play crucial roles. Starting HRT in early menopause seems to benefit the heart, while starting it much later may increase risk. Scared? Don't be. These are factors you and your doctor can discuss to tailor HRT to your needs. Timing is everything. Think of HRT as a dance partner. You don't want to join too early or too late. Research shows women who start HRT before the age of 60 or within 10 years of menopause onset reap the most benefits with the least risk. It's a balancing act. Outside that window, risks start to outweigh the rewards for many women. Let's take some of the most stubborn myths about HRT and give them the boot. Myth: HRT always causes breast cancer. Not necessarily. The risk is small and depends on factors like hormone type and duration of use. For some women, benefits may far outweigh the risk. Myth: you can't stop HRT once you start. False. While it's recommended to taper off gradually when stopping HRT to avoid sudden symptoms, you're not signing a lifetime contract here. Myth: HRT is a modern invention. Nope, it's been around since the 1940s, but science has vastly improved its safety and effectiveness since then. Menopause symptoms relief is great, but did you know HRT might improve more than just hot flashes? Studies suggest it can also boost bone health. Estrogen helps preserve bone density, reducing fractures. Improve mood and energy. Some women report feeling like themselves again. Lower risk of colon cancer. The estrogen versus colon cancer connection is an emerging area of study. Still, HRT isn't the fountain of youth. So what happens if HRT isn't the right fit? If HRT isn't for you, don't panic. There are other tools in the midlife wellness toolbox. Non-hormonal medications. Some drugs treat specific symptoms like hot flashes or bone loss. Lifestyle changes. Exercise, a healthy diet full of calcium and vitamin D, stress management, and quitting smoking can pack a big punch. Natural remedies. Supplements like black cohosh and phytoestrogens are popular but require further research. No single approach will work for everyone, but plenty of options exist for a tailored solution. Here's where it gets empowering. Whether or not HRT is a good fit comes down to you. Your age, health history, and personal preferences are the deciding factors. Think of it like designing a custom health plan with your doctor as your co-pilot. Ask questions like, will I benefit from HRT? What's the safest type for my situation? How long should I stay on it? Remember, HRT is not the villain, nor is it the savior. It's just another tool in the wellness workshop. Science never sleeps, and neither does research on HRT. From more precise bioidentical hormones to non-hormonal treatments that mimic estrogen's effects, innovation in this field is exciting. The goal isn't just to improve symptom relief, but to empower women with safer and smarter options for midlife wellness. To HRT or not to HRT? That is the question. The answer? It's deeply personal. What's important is having the knowledge to make an informed, confident decision. Armed with today's science and a little bit of curiosity, you're already miles ahead of the game. Whether you choose HRT, explore alternative treatments, or decide to brave menopause head-on, your wellness deserves the spotlight. So, what's your next step? Talk to your doctor, do your homework, and most importantly, don't let fear dictate your path. Hormone replacement therapy is much like life itself, full of mysteries, risks, and rewards. In the end, it's not about whether HRT is good or bad. It's about what works best for you. And hey, if this science-fueled chat lit a spark of curiosity, stick around for more explorations of topics that matter to your health. After all, midlife isn't the end. It's just another chapter to write, rewrite, and live out loud. Thanks for tuning in, and until next time, stay informed, stay curious, and of course, stay fabulous.